So it's a page by page thing. Okay. Yeah. Should be fine. Good afternoon, everyone, and welcome to our Herman Ostrow School of Dentistry 2024 White Coat Ceremony at this beautiful Boulevard Auditorium. All right. My name is Yang Chai. I'm the interim dean of the Herman Ostrow School of Dentistry of USC. It is my great privilege to be here with you, all of you today, as we officially begin your dental careers with this symbolic step. Today, you will put on your white coats for the very first time and take a solemn oath to uphold the values, traditions, ethics, professionalism, and compassion of almost 130 years worth of dental professions before you. But before we get to the business at hand, please direct your attention to the screen behind me to hear from some of those who have preceded you here at USC School of Dentistry as students.
Oh, this is going to be so embarrassing. The first time I went to the dentist, I had a ton of cavities. I think I was 5, but it's okay because I got through it, and here we are.
First time I remember going to the dentist, I remember I fell outside in my backyard and hit my tooth. I was crying so much, and I went to the dentist, and he did a baby root canal on me, and the pain just went away. It was like magic.
I don't remember being scared. I remember there was a big window, there was a tree outside. I remember just loving the smells and hearing him mix a bunch of things up in the background, and I just thought that was really cool.
I do remember my first week and first day of dental school. I was excited. I finally was in my career. I was in my profession.
I remember going up to the sim lab for the first time, and then you go and pick up this cardboard box, and inside it had your handpiece, your high speed, your slow speed, your rubber bowl, your spatula.
We got our cheeks, we got our typodonts, and I remember seeing my nameplate with my name engraved there, and it was kind of just a moment where everything felt real.
You're looking through all of these supplies, you don't know what some of these are, you have seen some of them before, and then all of a sudden you get a drill and you're just like, wow, this is real.
I remember picking this up and not knowing anything about it, but knowing that my dental journey was starting sooner than I could imagine.
White coat ceremony is the beginning of a transformational journey. When I don my white coat, I'm reminded of the responsibility that I have to always adhere to the highest codes of ethics and professionalism as I go to serve mankind.
To me, my white coat symbolizes a sense of achievement. It's something that I hang in my room very proudly. Before I go to class every day, it's something that I look at just to remind me. There's a lot of trust behind that white coat.
When I received my white coats, I felt that I am now having the responsibility to take on this identity as doctors.
So when you put the white coat on, it makes you feel like a dentist. It makes you feel like you're respected.
When a patient sees someone in a white coat, they know that we're here to help them.
It symbolizes the privilege that we get to participate in the lives of our patients.
It means honor by being part of a field that holds the patient care in the highest regard, and a responsibility to respect that care and respect patients every single day of my life.
I still wear the white coat, and students and faculty see me on the clinic with the white coat all the time. So it has a special place in my heart.
My advice to the students is to stay focused, to come prepared, to do your best every day, and trust that the Trojan family has your back always.
Come prepared, get ready to learn, grab every opportunity that you can while you're still in school.
Come every day if you can. Just be in the clinic and come stay upstairs, ask questions, and be very active.
Enjoy every single bit of this experience. It goes by so fast, and it comes at you so fast.
Always keep an open mind. You know, you may have your good days and your bad days too. always make sure to be flexible.
Don't be afraid to make mistakes.
Trust the process. Our professors and the school have put so much time and effort into our curriculum. Every student is going to come out of USC an amazing dentist.
Getting to learn from world-class faculty, it's something so surreal. You read about their names in articles and just being able to talk to them one-on-one, it's so fascinating to have this wealth of knowledge just right in front of us.
Well, one of my duties, I think, to the students here as a faculty member is role modeling and mentorship.
One of the most important things that I've learned here in dental school is that we want to treat our patients with respect, integrity, and utmost compassion.
You know, I've always dreamed of a life where I could care for people and be hands-on in that care, and the dental life is just right for me.
I will dedicate my professional life to regarding each patient
as a whole and complex person.
I will use the very best clinical diagnostic strategies.
I dedicate my life
to the health of those whose lives I directly or indirectly touch.
I will always conduct myself with conscience,
compassion, and dignity.
I will maintain, by all means,
in my power, the noble traditions of the dental profession.
I will honor my fellow students
as professional colleagues,
and together we will nurture
our shared humanity.
I will always maintain
the highest respect for human life.
I make these promises without hesitation,
freely, and upon my honor.
Fight on!
Fight on!
Fight on!
Thank you for everyone who helped to make that beautiful video. So students, today is an incredibly special day on your path to becoming Trojan dental professionals. It is a day that you will likely to remember for the rest of your lives as you dedicate your professional lives to the service of others. I, myself, have been in your shoes after earning a PhD from USC in 1991. I pursued a DDS from the Ostrow's ISP program, now called ASPID program, graduating in 96. Even now, I can remember the excitement I felt as I began my own studies at USC. Determined to get the most out of our dental education, to be able to eventually give back to my patients in ways large and small. As a former student, I can appreciate the years of preparation it took to get this point in your dental career path. You have to excel in all the prerequisite classes, studying late into the night and on weekends. You have worked to get additional practical experience, volunteering at the local dental offices or with a community-focused organization. You have spent hours researching the best dental schools, polishing those applications, and preparing for the entrance exams and admission interviews that awaited you. In short, you've had to make hard sacrifices in every facet of your life because you wanted to realize your dreams, to become an oral health care provider and to get the best education at our dental school at USC. With the appreciation in mind, I wanted to take this moment to really congratulate each one of you on this momentous occasion. It is a privilege reserved for the very few. And the fact that you are here today speaks to your work ethic, character, intellect. So audience, I ask that you join me in the round of applause for the incoming ASPID class of 2026 and the DDS class of 2028. so happy for you. Your dream school, right? Absolutely. Of course, none of this would have been possible without the steadfast support of your loved ones joining us today. A while ago, as we gathered outside to begin our processional march into this beautiful auditorium, I was struck by the year-to-year grin that I saw of the family members, the friends, and the significant others who have stood by you every step of the way. For those of you who are sitting on the second and the third floor, offering love, support, encouragement. So students, please join me in the round of applause for your loved ones in the audience today. Thank you. I know how hard it is when you go through dental school, so your family support and loved ones, it is absolutely critical. So students, over the next 2 to 4 years, the faculty and I are going to routinely push you past your physical and intellectual limits. This is entirely by design, because we realize it is when one is pushed past their limit that true growth happens. We are committed to making sure that each of you finish the program with the clinical skills, the critical thinking, and above all, the compassion it takes to be a successful dental practitioner. We are committed to forging the raw potential, intellectual curiosity, and useful exuberance that marched into this auditorium today into the competent, confident Trojan dental professionals. And while we will do our part, I have some advice for you to ensure that you get the best out of your dental education here at USC. Above all else, get involved. I want you to truly spread your wings while you are here at Ostrow and explore all that dentistry has to offer. Volunteer with one of our many community oral health outreach programs, providing dental treatment to those who otherwise have no access to oral health care. In developing your compassion as healthcare providers, and find your place within one of our student organizations, sharpening your leadership skills, and forging new bonds that will last you a lifetime. Take part in organized dentistry, such as CDA, ADEA, or better understand the professional landscape and hone your networking skills. Participate in student research as part of our annual research day to develop your lifelong learning skills that will truly serve you throughout your career. And take the time to explore your passions. Find out if you want to specialize with an advanced training certificate. Spend time with our military post-graduation program, or give back as a part-time or volunteer faculty member after you graduate. You are slowly building a dental career over the course of your studies here at Ostrow. Each day, each experience represents a brick. So make sure you're building a solid structure that will withstand the test of time. And after you graduate, make sure you take advantage of the many perks there are from being a member of the Trojan Dental family. You will automatically become a member of the Century Club Alumni Association, the Dental School's Alumni Support Group. The Alumni Association offers everything from mentorship to networking opportunities and connects you to the vast group of dental professionals across the globe. It is what being a member of the Trojan dental family is all about. And I started my first outside practice job through that connection after I graduated from our school. So with that, I would like to introduce our first speaker. It was just a few years ago that Patrick Yu was seated in the auditorium ready to put on his white coat for the first time, just like you are today. He had just completed his bachelor's degree in history from the University across town. Today, Patrick is a fourth-year dental student and the president of Ostrow's associate student body, who has considerable insight into what the next few years have in store for you. So please join me in welcoming Patrick Yu to the podium.
Thank you, Dr. Chai. Hello, everyone. I'm Patrick Yu, your ASPID Executive President, and I would like to extend a warm welcome to you all. Today marks Today marks the saga of which you all take as your first steps to become dental aspirants. As you step on this new environment, I want to impart some advice for your time here. First, your personal health is of utmost importance. This includes your mental and physical health. Practice mindfulness, view your feedback in a growth-based mindset. Please make sure you get adequate sleep and eat regularly, so that you can put all of your best foot forward. Your well-being is the bedrock upon which your success is built, so take care of it from day one. And lest we forget, I would urge you all to prioritize your own safety. Remember to follow infection control, and do not neglect to wear your personal safety equipment in full. Each one of you have committed so much to reach this point. Too much, in fact, to be squandering it by being reckless and careless. So I'll say it one more time for the sake of yourselves and your future patients. Please be safe. Additionally, I encourage you to refer to the expertise of our talented faculty. We are blessed to have leading experts in every field imaginable here at this school. While some of them may appear extra serious at first, I assure you that they are all wholeheartedly committed to your success. Their tutelage and counsel will help you navigate the many trials that lie ahead. Lastly, I would like to emphasize that the acceptance letter that each of you have received is a testament that you truly belong here. Remember, this school has chosen you, not just for who you are now, but for who you will become. As such, we have the utmost confidence in your potential and are excited to see you grow and achieve great things. Over the next few years, this school will be your home, where you will have the chance to explore your interests, cultivate new skills, and soar to new heights. We are all here to support you, and we look forward to seeing the incredible things that each of you have to accomplish. So welcome once again, and here's to a fantastic start to your time at this remarkable school. Thank you, and fight on.
Thank you, Patrick. Our next speaker has been through not just one, but two white coat ceremonies here at USC. But just when we were outside, actually, I learned there were actually more. And she attended her first white coat ceremony in 2017 when she was pursuing her bachelor's degree at USC in dental hygiene. She then put on her white coat again in 2019 as she began her studies for the DDS program here at USC, which she completed in 2023. While during her time at USC, she also served as the ASPID president, and then she also did the white coat ceremony at that time. And I'm just so proud to have Natalie here. She's now undergoing her postgraduate training in advanced endodontics at the University of California, San Francisco, after which she plans on settling here in Los Angeles. But San Francisco or not, no distance could keep her from coming back to USC. And the best dental school in the world, but also I know she is just has so much love for this place. So we're really delighted to have you here, Natalie, to really provide some advice for our incoming DDS students. Please help me to welcome to the podium Dr. Natalie Black.
You're the best. Perfect. Thank you so much to Interim Dean Chai for inviting me to be here this evening. It's so great to be back on campus. Like he said, I'm in San Francisco, but anytime USC wants me to be here, I'm here. And to our Trojan family and friends, and to the DDS class of 2028 and ASPID class of 2026, I am honored to welcome you to the Ostrow family. You have all worked so hard to earn your spot within this room, and I congratulate each of you on such a wonderful accomplishment. As Dr. Chai mentioned, my name is Natalie Black, and I recently graduated from Ostrow in 2023. Like many of you who just moved to Los Angeles, I know it can be overwhelming starting out in a new city. I actually moved to Los Angeles from my small town in North Carolina in 2015 to attend undergrad at USC, and after those 4 years, I loved the school so much that I decided to spend another 4 years here for dental school. Though I've now switched over to the UC school system for my residency in endodontics, my pride for the Trojan family will always run deep. My co-residents at UCSF often tease me about how much I love the school and my dental school experience, but it's very true that it's the greatest school in the world. During your time here, you will meet the most amazing people and forge some lifelong connections. And those connections will follow you well beyond your graduation days in 2026 and 2028. And now it's crazy to imagine that 5 years ago, I was in your shoes as a D1 student attending my own white coat ceremony. I remember being very overwhelmed at this point in the trimester during my first year. You're learning to drill on plastic teeth while trying to manage PBL, all while trying to balance your personal lives with your family and friends. It's sometimes easy to lose sight of the purpose behind the work you're doing every day. Though the PBL cases might seem difficult and demanding, and you might be questioning why you have to learn the mechanism of a blood clot to become a successful dentist, I promise you will develop the critical skills needed to treat patients through evidence-based decision-making. And though, I'm glad Dr. Park is here, because though his precise cavity preparations might seem like the end of the world now, because believe me, I'll never forget those 0.65 millimeter preparations. In just a short period of time, you will use those same hand skills learned in that class to treat underserved populations around the Los Angeles area through Ostrow's clinic, through mobile clinics, and even on Skid Row at the Union Rescue Mission. Throughout your time at Ostrow and your careers, you will change the lives and smiles of so many individuals. To keep it simple, I have 3 pieces of advice to give to you all. The first piece of advice is to be resilient. Over the next few years and throughout your careers, I challenge you to view failure not as a setback, but as an opportunity for growth. As a perfectionist myself, I know how hard that can be. I still vividly remember failing my first clinical exam. I was performing anesthesia injection techniques on a brave classmate of mine. I happened to miss a few of the landmarks, and I failed. I called my parents in tears, and my dad gave me some invaluable advice. He said, "Natalie, you're in school to learn, and no one expects you to be perfect. If you could do everything perfectly the first time, you wouldn't need to be in dental school. And of course, your parents are always right. Shout out to them who are watching from the live stream at home today, but they're always right. But since that day, I've made many more mistakes, but my mindset is no longer to be sad or disappointed in myself when something doesn't go as planned. I've learned to see each experience as a chance to grow. In our profession, we are lifelong learners who practice dentistry. And I love the word practice because if you remember that every day you show up is like a new day of practice, you can understand that dentistry is kind of like a sport. And each day is an opportunity to refine our skills. Just like athletes such as Roger Federer or Steph Curry, who continually practice despite their expertise, we too must accept that making mistakes is part of the journey. By being resilient and learning from our errors, I promise you will eventually become expert-level clinicians and the Roger Federers of dentistry. My second piece of advice is to keep an open mind and follow your curiosities. Some of you may have entered dental school dead set on sticking to general dentistry, whereas others might be set on specializing. Some of you might even be sitting here after drilling on those plastic teeth for the first time, feeling unsure if this is really the right career for you, and that's okay. Trust me, it is an amazing career, and the world of dentistry is not black and white. There are so many possibilities. If you find yourself interested in a specific facet of dentistry, follow that curiosity. I entered dental school convinced I would do orthodontics, but to my surprise, I gravitated towards endodontics during my second year. I know it's hard to imagine that root canals can be captivating, but they did draw me in. I found some amazing mentors, shout out to Dr. Burdan and Dr. Basali, who helped me discover my own niche within dentistry. Each of you will have your own unique path, and that's okay. One of my favorite things about this school is that you'll be exposed to everything during your time here. Use this as an opportunity to ask questions, seek mentorship, and let your interests guide you wherever they may lead. Most importantly, my third piece of advice is to enjoy each moment. Like I said, this is truly the greatest school in the world. Get involved with clubs, research, outreach, and everything USC has to offer. One of my personal favorite experiences during dental school was traveling with my classmates during my first and fourth years to provide dental care to those in need in the Philippines and in the Bahamas. And after being in the UC system for residency, trust me, these are not normal things. USC really offers a wealth of opportunities at your disposal. And don't forget to take care of yourselves too. Take breaks, work out, go to the football games, call your loved ones, and enjoy everything Los Angeles has to offer. Though the 4 years might seem long now, it will fly by faster than you can imagine. So to recap, be resilient, follow your curiosities, and most importantly, have fun. Welcome to the best career and to the Trojan family. Congratulations and fight on.
Thank you, Natalie. Our final speaker this afternoon is also an Ostrow graduate, having completed his DDS studies here in 2001. Today, Dr. Parrish Savzadeh is a professor of clinical dentistry and co-chair of Ostrow's Department of Diagnostic Sciences and Anesthesia and Emergency Medicine. He's a board-certified oral and maxillofacial pathologist and a diplomat of the American Board of Oral and Maxillofacial Pathology. In addition to being a clinical and surgical pathologist with 2 decades of practice experience, Parrish is also a clinician scientist who conducts clinical and laboratory research, publishes in high-impact journals, consults, and teaches. His research focuses on head and neck cancers, along with the characterization and treatment of microbial biofilm infections, particularly osteomyelitis and osteonecrosis of the jaw, where he has developed and tested novel bisphosphonate related drugs and conjugate that target bone infections. So please join me in welcoming Dr. Parrish Sazade to the podium.
Thank you, Dr. Chai, for that warm welcome. All right, let me get my glasses on. Okay, so good afternoon, everyone, my fellow Trojans, and that includes all the friends and family that are here. It takes a village, and none of you can get here alone, and you really can't do this alone from here on to get out of here. So like you, over 20 years ago, I sat right there and participated in my white coat ceremony. I was an incoming dental student. My mom was here too. She was sitting somewhere up there. And afterwards, she told me it was one of the most beautiful days of her life, and it was one of the most rewarding. We got a young Trojan. I like that. It's never too early to start him. That's great. And I asked her afterwards, I was like, why was that one of the happiest days of your life? I had just graduated from UCLA. That can't say it, yeah. I know some of you are from, you got to let it go. The rivalry is real, let it go. It's USC now, right? So that was a big deal for me, first in my family. And I asked her why later. I said, why was this such a special occasion? And she said, because I knew you were in a place and a profession where you'd be okay for the rest of your life. And I'd be fine as a single mom. That, I got it. It made sense. At the time, I didn't quite get it, but I do now. I have a young son, amazing wife. I know what she does for our family and our son. And now I understand why this was the biggest deal. Not graduating from, and not even graduating from dental school, right? I hadn't taken a single class yet. I hadn't passed a single course. I hadn't done anything. But here I am, right? And I'm still here with the honor of speaking to you at your white coat ceremony and teaching the next generation. So I look forward to seeing all of you soon in courses and clinics. And for the first time since, I brought my mom back. So she's here. Hi. I wouldn't be here without you. So I couldn't get you in the front row last time, but now you're, right? Not bad, right? Yeah. She always nags me to come to my continuing education courses or hear me speak or present some research. And I'm always like, no, Mom, I'm not a kid anymore. You can't come. And Persian mom, so those of you that know. So I know it's a big deal for her to, be here. So, love you. So I was told to give you some words of advice. And everyone already said it. Dean Chai, Patrick, mind, body, soul, research, get involved. All that is great, and it's really easy to tell you what to do to succeed because statistics, which you'll get very shortly by Dr. Navozich regularly, will show that almost every one of you are going to graduate, whether you like it or not. Almost every one of you are going to pass your boards, whether you like it or not. Or are you going to practice dentistry or some amazing specialty we have in dentistry? So don't worry about that. All those are well-documented statistics. But the only advice I really wanted to give you is to enjoy these years. They will be among the most lasting and enduring memories and friendships of your life. So make the most of it. All those high school and undergrad courses that you had, the prereqs you hated, you're like, what the heck do I have to know this for? This is when you get to apply all that. This is when OChem and physics and calculus and all, you're like, what does that have to do with anything? You'll see very shortly in your courses why you needed to know all that material, and it will help you with direct patient care and safe patient care, and everything will start to make sense. As crazy as it sounds, you're going to get a DDS from here, which is a doctorate of dental surgery. It's a surgical discipline, and you're going to be a doctor of surgery. That's a big deal. People are going to trust you. They're going to trust you with their lives, not just their mouth. Right? The mouth is connected to the body, and we look at it systemically and as a whole. You will regularly operate on patients and treat oral, hard, and soft tissue pathology, including caries, periodontitis, mucosal pathology, osseous pathology, salivary gland disorders, odontogenic cysts, odontogenic tumors, and much, much more. The maxillofacial structures are rich with anatomy, like bones, skin, connective tissue, muscles, glands, a little bit of what's everywhere else, right? Here we protect you. We nurture you. We teach you the art and science of dentistry. We protect you from real-world stressors. You're safe here, and you will have good experiences in faculty, and you'll have bad experiences in faculty. No, not faculty, no. I'm the bad faculty. But what you get out of this place is directly predicated on what you put into it. So make the most of it. Like you, I paid a lot of money to come here, and I made the most of it. And I highly recommend you do the same. Engage. Learn from our world-class faculty. I had a course with Dr. Chai in anatomy. He's still teaching the course. And where else do you get this? A dental school dean, PhD, oral surgeon, one of the most highly cited, renowned, awarded scholars of the profession ever. And he's right here. He's yours. You can talk to him. He's a really nice guy. He's a great guy. So one of the most influential experiences that you'll have here is walking among the giants that are here. We have faculty that are true experts in what they do here. They help me achieve my academic and professional goals, and they will let you and help you do the same if you let them. Our faculty aren't here because we make the big bucks in academia. They're here because they love to teach, and they want to teach the next generation. So whether you get a hard faculty or an easier one or a nice one, they're all here because they love to teach and want to be teaching you. With me specifically, you're going to interact in all 4 years, mainly in the context of oral and maxillofacial pathology and oral medicine. I will teach you about oral and systemic diseases, lesions including oral head and neck cancers, which are among the most fatal of all cancers, with higher mortality than breast cancer, lung, prostate, melanoma, leukemia, lymphoma, and many others. What you learn here may save the life of a friend or a family member one day. And I say that because every few years I get a former student that sends me an email, calls, texts me, and says, hey, my grandmother or my mom or my cousin has this lesion, and the dentist said not to worry about it, but it's not getting better. And I remember you teaching us that this is not something that should, be looked at and maybe biopsied, and they didn't do that. And so I say, okay, just send them to me, and I see them. And it happens regularly. Every few months I get a case like this from one of our graduating students. And I see the patient, and I do a biopsy and diagnose it with cancer usually, but it's often an earlier stage, and it's treatable, and they're thankful, and I'm happy, and it's a win-win, right? Because they're learning what we want them to learn, and they're looking at their patients as a whole. So I really recommend that think of every one of your patients as that family member, the one you like, all right, that family member. Talk to them, treat them with respect, look at them as a whole. Catch cancers early, save lives, be a doctor, live up to your degree and the training that you will get here. And believe me, patients that see you are highly trained and care about them and support them will make your life easier. They'll be appreciative. And they'll be the ones that aren't going to sue you, even if you're in the wrong. So take my advice on that. And start building your career here as a member of our Trojan family. And eventually, at some point, when you can, don't forget to pay it forward. Whether it's a patient in need that can't afford care, maybe a family member or a friend, or to come back like us and teach the next generations to come. Thank you, and thank you for choosing us, because I know every one of you that got into this school likely got other acceptance letters and could have gone to likely multiple other schools. So thank you for choosing us, not just us choosing you. And best of luck on this amazing journey. This is going to be some of the best years of your life, and it will get hard. And when it does, just remember our USC Trojan mantra of fight on.
Wow. Great job, Parrish. So at this time, I would like to begin the process of the donning of your white coat, a momentous step forward in your journey to becoming healthcare professionals. Putting on the white coat and taking the solemn oath of a healthcare professional is an awesome responsibility reserved for the few. By taking part, you are making a promise to yourself, your community, and every single one of your future patients. You are committing to conducting yourself with the professionalism, integrity, and excellence of all the classes who have come before you here at this historic educational institution. You are joining an exclusive club which will require much of you. It is a responsibility that I'm certain you are more than capable of taking on. To help us, I would like to invite the following faculty members to the stage to help us with the white coats. Parents, we know how proud of your loved ones you are, but do know that we have professional photographers here at the stage who will be taking pictures, so you don't have to. You can enjoy the moment instead of worrying about documenting it. Students, please pay attention to this. After each of you is white-coated, we will proceed with the oath of a healthcare professional. So please return to your seats. Please join me on the stage, our faculty members helping with the white coat. Dr. Christine Edwards, Dr. Mavash Navazesh, Dr. Jin Ho Park, Dr. Anita Tora, and Dr. Parrish Salzadeh. I would also like to thank Dr. Lisa Popkov, who will be reading the students' names. The students will be called up to the stage 5 at a time. They will line up in front of our faculty members and be white-coated together as a group. Afterwards, I will lead the recitation of the making of an oral health professional. With that, let's get started.
All right, testing. You can all hear me? Good. I wish this was wine. Okay. Are you ready? Let's do this. Okay. Adam Adel Al-Kurdi. I'm so sorry. Thank you. Okay. Nathan Yosefi. Andre Boudica. Christian Kamal. Mazyar Sakyani. Hold on. Excited. Next, Nazir Hamzavi. Umer Shazad. Ahmad Kazi. Fahmi Malkeya. Ahmad Abusha. Gaeth Aljara. Devin Sagarian. Harutun Wafalyan. Matthew Nazarian. Oh, Arvin Kachaturian. God, Lord help me. Okay. More water. Okay. Off we go. Okay, Irfan Zioi. Neda Seoi. Andrew Regian. Shant Terzian. Dorsa Molai. Rahel? Kedri. Got it. Rahel Kedri. Yara Al-Mashriki. Bara'a Al-Boeij. Nikita Dullah Shahi. Kimia Tufigi Rad. Okay. Sina Samimi. Nushwa Abukhdar. Hina Kiyum. Danya Abuamaish. Sukhmandeep Sidhu. Jasmine Manak. Angelina Haddad. Megan Veal. Sage Gutman. Noor Daniela Fagani. Donya Cave. Okay. Michelle Berenson. Leor Isayed. Anya Dadka. Shiva Hujjati. Oh, my Lord. Okay, how are we doing? I practiced swimming. I'll still get it wrong, but I'll practice it. Alice Guyumjian. Monet Jafari. Alexa Korshad. Ashley Hakimian. One more? Okay. Rachel Landon. Rebecca Dai. Lauren Kanju. Doreen Famini. Eli Alicia. And Emmanuel Haruni. Yes, it is. Thank God. I know. Okay. Daniel Hakimi. Jacob D'Amico. Ilan Kashkurman. Yehuda Senahi. Ethan Kohante. Brian Doe Nguyen. Patrick Kasuan Eloran. Daniel Bong. David Ku. Zion Jung. Thank you. Oh my God, we're not halfway done yet? Oh no! No, okay. Austin Yu. Cindy Chow. Isabella Chiturian. Oh, honey. Kanadi Komana Pruser. Trying, everybody. Joyce Pham. I'm so sorry, families. I'm trying. I hope I'm not butchering too much. Just a little. Okay. All right, I can do this one. Okay, Sarah Lynn Nguyen. Lee Drew. Cindy Wu Deng. Yena Zhang. Karen Chan. Claire Chin. Yalim Diane Cho. Kaylee Quinn. Michelle Turchin. Alina Chilingarian. Justina Antun. You gave it to me. Justina's lucky she gets her name twice. Justina Antun. Melanie Riscala. Justina Girgis. Kyle Rex. Mark Kane. Dondis Maxi Moreland. Daisha Hanno. Rehan Hadassah Lynn. Megan Huff. Isabella Ma. Lana Makta. Andre Masur. Samir Hawawa. Emma Saeed. Anis Heraptian. Sona Daftian. Dara Patel. Sophia Arkelian. Natalie Yehivian. Oh, Haider Ali. Hasil Tachak. Abhishek Patel. Sharmini Balandran. Sejal Gopani. Olivia Voss Ball. Atta girl. Atta girl. Make my life easy. All right. Krishna MS. Satya Susmitha Nunabodi. Princey Thomas. And Rupika Beether. Joyce De Lima. Patricia Forte. Leda Brady. Daniela Jimenez Villalobos. Alejandra Sosa Perez. Ocio Lelume Uloco. Oliver Macbeth Sason. Huda Yakubi. Radwan Gazwani. Ariana Zamanafar. Mariam Sahai Manesh. Halfway? I'm not mostly done? People are laughing at me. You come try do this. Thank you. Okay. Solale Amipur. Amira Hussein. Lina Glessa. Karaman Nassar. Maram Bhuta. Naveed Taher. Victor Marufo. Driss Samari. Murshi Chowdhury. Majde Okan. As ready as I'm going to be. Gursimarin Tour. Jawad Abu Nassar. Abraham Dukes. Daniel Namgun. Daniel Lee. Sophia Dale. Olivia Hall. Taya Hartzell. Ryan Harris. Brianna Farman. Elizabeth Tynan. Emma Kraft. Isaiah Gomez. Ryan O'Hara. Audrey Yin. An Lee. Joanna Kwok Ching Lau. Harry Vu. Okay, Logan Larson. Ho Jung Chung. Mohammed Yuzan Natuf. Tejin Surin. Okay. Micah Jiwei Lee. Glad he dressed up. Okay. Hello. Oh, okay. Tarek El Masri. Ahmad Marashli. Alex Lee. Brandon Loy. Fred Son. Hang Bo. Hua Nguyen. Tree Lee. Michael Su. Mark Cho. Justin Lam. Caleb Chen. Justin Shimizu. Aaron Shah. Raghav Kare. Okay, how are we doing? Brian Pham Nguyen. Jacqueline Nguyen. Ria Kantiwaja. Kate Fuji. Yuna Han. Thank you, dear. Oh, it's okay. Are we down to the end? I survived this almost. It's all about me. Okay, Isabel Molokon. Shania Harsono. Mingyoung Lee. Savera Ahmed. Ethan Pham. you want me to follow them? Dr. Popov, you come this way. Go this way.
Thank you so much. Yeah. All right, another round of applause. Thank our faculty for helping with this. Now, if I may ask all the students, please stand up. Students, please repeat after me. I will dedicate my professional life to regarding each patient as a whole and a complex person, promoting health to all people, identifying risk factors, and serving as an advocate for disease prevention. I will use the very best clinical diagnostic strategies, provide the finest clinical treatments and therapeutics, and continue to learn, revise, and enrich my knowledge throughout my career. I dedicate my life to the health of those whose lives I directly or indirectly touch, my family and friends, the broader community, my individual patients, and their families. I extend to the learned faculty, staff, and fellow students my full respect and gratitude, which is their due. I will always practice my profession with the highest integrity, thoughtful judgment, and skills derived from scientific evidence. I will always conduct myself with conscience, compassion, and dignity with the health and well-being of my patients and community as the first consideration. I promise to respect the privacy of my patients. I will maintain by all means in my power the noble traditions of the dental profession. I will honor my fellow students as professional colleagues and function in such a fashion as to earn their trust and respect. And together, we will nurture our shared humanity. I will not considerations of religion, nationality, race, or ethnicity, gender, or sexual orientation, disabilities, political choices, or social and economic standing interfere with my duty to the patient. I will always maintain the highest respect for human life. I make these promises without hesitation, freely, and upon my honor. Congratulations. Please be seated. At this time, it is my honor to officially welcome you to the Trojan Dental family. On behalf of the school's faculty and staff, I congratulate each one of you individually and all of you collectively on this notable distinction and wish you all the best as you continue your studies here at Ostrow School of Dentistry of USC. To our student family members and the loved ones and significant others, thank you for joining us today and for entrusting us with your loved ones' oral health education. We are so excited to have you here at the Herman Ostrow School of Dentistry of USC. I also wanted to take this opportunity to thank our speakers, Patrick, Natalie, Parrish, and all of our faculty who helped with the white coat. And most importantly, the staff members really worked so hard on the Sunday to put this together. Thank you so much, and fight on. The marching band is coming. All right, ladies and gentlemen, USC Trojan Marching Band. So now concludes the ceremony. And students, please, march out and then reunite with your family and loved ones and take pictures, celebrate. Welcome to Ostrow School of Dentistry of USC. And fight on! Congratulations. All right.